Thank you, Dr. Lenz. Next, we have Ann Schiele. Dr. Ann Schiele is President and Dean of Mount Carmel College of Nursing. For more than a century, Mount Carmel College of Nursing has been providing nursing education to young students with one of the largest baccalaureate nursing programs in the state of Ohio. Dr. Schiele played an integral role in the process of transitioning Mount Carmel from a diploma program to a fully accredited college and has been recognized as one of Ohio's leading women. Please welcome from Mount Carmel College of Nursing, Dr. Ann Schiele.
Good morning. I here, as the others, am certainly to speak in favor of Senate Bill 89, the Comprehensive Nurse Education Bill. This is National Nurses Week with the theme, Nurses Building a Healthy America. But in order to guarantee this high quality and affordable and health care for all, we are going to need to reshape the healthcare system. And certainly, nurses are the professionals that will greatly impact this change. But in order to continue to impact change, we must have additional faculty to educate additional future professional nurses. Passage of Senate Bill 89 will be a big step forward. Increased funding will support the preparation of additional qualified PhD and master's prepared faculty. One of the problems with doctoral prepared faculty, certainly at Mount Carmel and with my colleagues, as the average age of our doctorally prepared faculty now. I know at Mount Carmel, I figured this out, and our average age is 54 years of age. And the only reason it's 54 and not higher is that one of our young doctorally prepared faculty is 28. And if it wouldn't have been for that, we could have been 58, 59 years of age. The other scary factor, and again at Mount Carmel, but I'm sure my colleagues share in this, is that we have several faculty working on doctoral degrees, and their average age is 55. So therein lies a problem that we need to educate future masters and certainly doctorally prepared faculty. The other problem that these doctoral faculty have and students is the loans that they're getting in going to school. They are averaging at our institution between $40,000 and $60,000 in loans to get their PhD. And that, to me, is an awful lot of money. For fall 09, we are having over 600 applicants, at least 400 of them well qualified for 140 spots in our freshman year. And I'm no different than my colleagues that we were just mentioning here. If we had additional qualified faculty, we would be able to enroll additional students. We've done many things with our master's program. We're getting it online. We offer it 1 day a week. We're doing these things that would entice people to come back, earn the master's degree, certainly teach, and then they're able to move on to the doctorally prepared programs. But one of our other problems is many of them do not go full-time. They feel they cannot afford to go full-time. They must keep their positions that they have in practice. It's because of the cost of the program. So increased funding will certainly shorten the time needed for them to graduate, and it will impact enrollments in our educational programs. So in summary, nursing needs increased funding to educate faculty so that they can positively impact those professional registered nurses for the future that will change our healthcare system.
Is Barbara Schaffner. Barbara is the chairperson of nursing at Otterbein College in Westerville, Ohio. Ms. Schaffner has been a member of the Doctor of Nursing Practice Curricular Task Force since 2005 and has participated in countless nursing department committees. She has been recognized with such awards as the Nurse Educator of the Year from the Ohio Association of Advanced Practice Nurses. Please welcome from Otterbein College, Barbara Schaffner.
Thank you, Senator Ryan. I'm very pleased to be here. Many of the concerns that I have in support for this bill is based on many of the reasons that Dr. Lenz and Dr. Schiele have already articulated so beautifully. and I appreciate my being able to be here and support what they had to say. The nationwide nursing shortage is certainly occurring now and is projected into the future, and you all know that's been well documented and publicized. We can't say it enough, so I'll say it one more time. One of the major reasons for the projection of a continuing nursing shortage is related to a nationwide and Ohio-wide shortage of nursing faculty. Senate Bill 89, which provides support for nursing education, will help expand the candidate pool of qualified nurse educators. More funding for the nurse education program through the Nurse Education Assistance Loan Program will allow more registered nurses to attend graduate school to obtain the degrees that are needed to become part of a nursing faculty candidate pool. At Otterbein, like many other schools across the state, we have had faculty openings but find only a small qualified applicant pool. Currently, and for the last 2 years, we have filled one of our full-time faculty positions with a visiting professor, very well qualified, but still committed to the program for a short period of time. Our goal, of course, is to find a faculty member that can and will provide stability through longevity in this position as a faculty member. On the other hand, the Senate Bill 89 will also help increase the nursing faculty candidate pool through recruitment of nursing faculty who are advanced practice nurses in other states. Breaking down those barriers, as is stated in Senate Bill 89, for advanced practice nurses to practice in Ohio will bring more APNs to Ohio for the benefit of faculty and also for the benefit of healthcare delivery in the state. As a practicing certified nurse practitioner, I know how much we need not only faculty, but we need qualified advanced practice nurses to help meet the needs of primary care, midwifery care, clinical nurse specialists, and nurse anesthetist care within the state. Increased number of qualified nurses for nursing education roles will be very welcomed. Increasing nursing faculty size will ultimately lead to increasing nursing student enrollment, with, of course, the result of increased numbers of RNs within Ohio. I and many of my nurse educator and advanced practice colleagues around the state strongly support Senate Bill 89. In summary, my support for Senate Bill 89 is based on the fact that an increased number of nurse educators will result in an increased number of registered nurses. And evidence and research strongly documents that an increased number of nurses at the bedside in the state in both generalist and advanced practice does increase the quality of care for all of Ohioans. Thank you for this opportunity.